Dr. Davis here from South Georgia Spine and Joint Center. Today we want to talk about the concept of cervical radiculopathy. So what that is, that's just a basic term for sort of neck pain that radiates down the shoulder and down into the arms. It can sometimes go into the fingers and the hands. So some of you probably know people who have cervical radiculopathies, and there's many causes for that, from degeneration to disc problems to postural problems, tight muscles. There's multiple factors here. But with cervical radiculopathy, there's very specific tests and things we do to assess to give us the understanding of where is that radiating pain actually coming from. And a lot of times, radiating pain that goes down in the hand kind of gets confused with carpal tunnel, which is technically right here. So our goal is to kind of sniff things out and say, hey, is it coming from here? Is there entrapment up the arm? Or is it actually coming from the area where all these nerves come out of the neck? And that's a typical cervical radiculopathy. There's many factors and things you can get into where you call radiating symptoms versus radicular symptoms, and that has to do with where its presentation comes from. But for the purpose of this video, we're going to discuss just radiculopathy in general and what causes radiating nerve pain and how can you treat it. So when we're really assessing the neck, all right, we bring a patient into one of our assessing rooms and we get an idea, where is this radiating pain coming from? So one of the best techniques you can do is just basic orthopedic tests and basic neurological tests. So orthopedic tests kind of situate the neck certain ways, and we push down on the head and move the body certain ways to see if it can give us some information. So looking at this guy here, obviously the neck muscles are up here. So if you had that head right here, there's a lot we do where we kind of push down on the head and we have them turn the head and push down. And what it's doing is it's stressing all these little areas right here where those nerves come out. Okay, so when you're compressing that area and kind of moving things around, it'll give us information of, yeah, I'm getting that pain down there when you do that move, or I'm getting pain here when you do it this way. So it kind of gives us an idea that maybe a nerve is getting compressed, and that's kind of one way we can do that. Neurological tests are another good one, because when the nerves come out, they go down the arm and they spread out into different parts of the body, different muscles of the arm, all the way down to the hands pretty much, and they kind of branch off. So there's certain tests you can do that test the strength of all those little nerves. So you're coming here and you're pushing down on their shoulder, then you're pushing their arm, then you kind of push their wrist down. So there's many tests we can do that says, hey, if you're weak in a certain one of these patterns, we can kind of sniff out that maybe that radiculopathy is coming from the neck, and we can kind of pinpoint exactly where it's coming from the neck. So orthopedic tests in our evaluation and our testing is our bread and butter. Then we take x-rays and we put everything together to say, here's what the x-rays show, here's what the exam shows, and if we need advanced imaging, like MRIs and things, we'll do those things. But it definitely, doing a great thorough exam will get us to a point where we're not confusing other conditions. So as I mentioned, carpal tunnel is a big one on most people. People that sit at a desk, sometimes during pregnancy, wrist swells up. There's a little kind of band that wraps around here and gets those nerves and stuff getting trapped to these three fingers. So a lot of times when someone's getting a cervical radiculopathy, they sometimes confuse it with carpal tunnel. And there's very specific tests we can do that say, no, it's not this, it's this, or no, it's not this, it's this. So that's what we do. We kind of determine, which one it is. There's all kinds of other places in the arm that these nerves can get entrapped. So one of the other parts is up here in what we call the pectoralis minor muscle. And then deep in here where the clavicle and these bones are here, there's a thing called the thoracic outlet. Now, what happens is all these nerves that come out of the neck, they go down into this little outlet, and then they start to split off and go down the arm. Well, right where they're coming into this little outlet here, there's a few muscles that get real tight on the neck. It's just classic for people to have tight muscles here, the way we sleep, the way we breathe, the way we live, sitting a lot. These guys get real tense, and what happens is sometimes they can compress the nerves and the blood vessels actually. All right, so they call that thoracic outlet syndrome, but a lot of times that can give you radiating pain down the arm. So there's a whole array of tests that we can do that to determine, hey, it's actually probably not coming from the neck, it's actually coming from your thoracic outlet. So there's many confusions with cervical radiculopathy because it can be 4 or 5 different things. And we do a great job here at South Georgia Spine and Joint of figuring out, hey, where is the real problem? Where is it coming from? And we rule those other conditions out. That's what you have to do. Now, reasons for radiculopathy, if we've determined that it's not coming from anything else and it's coming from the neck, then we look at what is the condition. And we've mentioned this in past videos. You know, degenerative disc is a classic one. All right. So as we said before, you got that disc space and it starts to get a little bit more compressed and a lot of degeneration and more bones sort of being laid down, and you get little spurs that come off the neck. That can actually cause radiating symptoms because the nerves are there and that degeneration is kind of impeding on those nerves, so to speak. So that's a big one. Bulging disc or herniated discs. It's classic with sometimes people sneeze and cough and they damage their disc. Sometimes it's picking up kids and leaning over, on the computer with the head out like this. So there's a lot of presentations, that can cause herniated discs and bulging discs. And we've explained that also on another video. But those are 2 of the 3 of the main conditions that cause cervical radiculopathy. When I see someone say, I'm getting pain down the arm, the first thing I look at is, okay, is it a disc problem? Is it bulging or herniated? Because that's one of the most common. But as you start to do your exam and you see, may not be a disc, now you start looking at thoracic outlet. You start looking at other entrapments. Is it carpal tunnel? Probably not, but it could be. So looking at all those, looking at all the orthopedic tests definitely feeds us into giving an idea, of where the condition is originating from. Posture is one of the biggest ones. So people, like I said, that sit at a desk, they have rounded shoulders, they have necks that come out. When you have those sustained postures for years, over time, that can cause degeneration. That can cause disc problems, or it can cause the spine to move and turn and shift and turn your head. All those presentations, if they're there long enough, will wreak havoc on the discs and the nerves later. So it's imperative that people get checked and get an idea of what's going on in their neck before you get those problems. But let's take a look at, what are all these nerves that come out of here, and what does some of that degeneration look like? Give you a better idea of what causes cervical radiculopathies.
So if we take a closer look at these nerves and all these nerves that come out of the neck, you can clearly see from pretty much the top of the skull all the way down, we get a whole, what they call plexus of nerves. So what they call these nerves is the brachial plexus, all right? Now this can get real confusing because all these nerves that come out, they kind of go this way, and then there's ones that go underneath, and then there's ones that cross over, and ones that come down. So all these are very particular to certain muscles that go down the arm. So if you can see some of the names of some of these on this side, and then C5 to C7, C8, T1. So these nerves will innervate muscles that eventually get to the hand. So as I was stating before, a lot of these times we can confuse carpal tunnel with problems up here in the neck. Okay, so this is probably one of the toughest things to learn and understand is this brachial plexus, because it's very complex, and there's certain patterns where you can get, entrapped all the way down through different muscles, as I was saying earlier, in the pec minor in the front here and all the way down the arm. But if you have a true cervical radiculopathy, that'll come from the nerve root here most of the time. So it could be degenerative disc or a herniated disc here, but anytime something's not functioning right here and it's encroaching on these little nerves, you'll get a lot of radiating pain that goes down the arm, and it just depends how bad this situation is and this problem is how far down the arm that it goes. So again, we're looking at preventing all types of surgeries, and with a multi-integrated approach to a cervical radiculopathy, you can decrease the inflammation here, get these joints moving better, and strengthen the muscles around it and try to fix the posture that's causing all these problems. So using the integrated approach is how we do it at South Georgia Spine and Joint, and that is technically the answer to solving a cervical radiculopathy.
So chiropractic is the first line of defense, for the cervical radiculopathy. Now, as you know, we're a medically integrated facility, so we're going to end up, explaining how medical and physical therapy can also help. But with chiropractic, one of the biggest things that starts here is immobilization. So over time, with the things we do and the lifestyle we live and the things we pick up and the way we sit and move, you start to lose motion in that cervical spine at first. And this could be years ago. Then because of that immobilization and not moving properly, you start to get that tissue stress and inflammation at those little joints. Okay, so when you get that tissue stress and inflammation, that starts the inflammatory process. Now it could take years, but over time that causes degeneration. It causes some of these muscles are weak. It causes you to be more susceptible to disc problems, herniated disc, bulging discs. So the key is posture and making sure these guys move so you don't encroach on that nerve. So the biggest thing I see is, you want big space for that nerve, and wherever that nerve comes out, you want that space to have a lot of room for the nerve. But if you start enclosing on that nerve, now all of a sudden, that's where problems start with regards to a cervical radiculopathy. So with chiropractic, there's many different techniques, and everyone thinks it's just one technique, but getting the thoracic spine to move and sitting on this table and getting that neck to move, and there's different ways to do it with traction, a diversified activator, which kind of, uses the little clicker in there. Every presentation is different and everyone's condition is different. So even though everyone comes in with cervical radiculopathy, the way we treat it depends on what are your past injuries? What do the x-rays look like? Do we have an MRI? Are there major arthritic changes where there's lots of bone in there, lots of immobilization? These are all the key things we find out in that initial exam, so we know how to treat you. But with chiropractic, there's many different techniques, not just the rotary brake that people are used to, where you're coming in and getting that little rotation in there. There's many techniques that can help cervical radiculopathies, and we've helped thousands of people, relieve their pain with radiculopathies. And as we said, with the lumbar radiculopathy, if you're getting pain down the arm and it's going to the hands, our goal over time is to get that numbness, so to speak, to kind of track back towards the neck. So we call that centralization, okay? When it's going down past the elbow and into the fingers and the hands, that's called peripheralization because it's going away in the periphery, all right? So what we're trying to do is over time, when we're solving this dysfunction, you'll start to see that numbness and pain and that radiculopathy is going to start tracking back. And we're going to ask patients, how do you feel today? And they'll say, well, I feel good. It's actually only going to my elbow now. And then weeks down the road, now it's only going to my shoulder, even though it started off when it's making numbness in the hands. Then all of a sudden it'll track back.
So like all conditions at South Georgia Spine and Joint Center, our medical team is a very intricate part of everything that we do. So when we're talking a cervical radiculopathy and you're getting pains down the arms, a lot of times, and I've mentioned this before regarding the lumbar radiculopathies, a lot of times there's a lot of inflammation in those joints. Whether it's on the little end plates, if it's on the nerve itself, or just inflammation in general. When you've had dysfunction in there for years or decades, and you're not moving right at those joints, and you're impinging on that nerve, there's going to be an inflammatory response. So what our medical team does is we got 10 to 15 different options of regenerative medicine type things, where we're trying to prevent all types of surgeries. That's the number one thing. So our medical team and staff is excellent and certified to do a lot of regenerative medicine, a lot of cool things, cutting edge things that a lot of people aren't doing. So at South Georgia Spine and Joint, that's one of the people you see first, is seeing our medical team so they can evaluate you and they can determine, hey, how can we reduce this inflammation? Because I've seen a lot of people with cervical radiculopathies that, you know, they'll be doing other treatments, but the inflammation is still there. You know, so the key to this is to, you know, they may drop their pain with some of the other services, but once that inflammation is gone, then that's a game changer, okay? And I've seen it time and time again. If we can get that inflammation to go while we're solving the dysfunction of the spine and the radiculopathy, that's for a more permanent solution, okay? But if you're constantly re-inflaming yourself over and over again with your daily activities and just the dysfunction that's there, that's where people don't get better over time, you know, and we see it a lot. So our number one thing is our medical team will evaluate you in their own way, get an idea of what you're a candidate for, you know, and use MRIs and some of the advanced imaging to see where are we going to go, where's the inflammation, how can we reduce it. And now the physical therapy and the chiropractic work 10 times better because you're not re-inflaming yourself. So using that medical aspect in a multi-integrated facility, and specifically for radiculopathies of the cervical spine, medical team is such an important part to getting that inflammation reduced and starting the healing process.
So as we stated with all conditions, physical therapy is such an integral part of every condition. And the biggest factor for that is once again, this word comes about, is being functionally resilient. And for a cervical radiculopathy, being functionally resilient is a demand of the body. So what happens is, we've mentioned that posture is a big key that starts the process of radiculopathies. We'll get rounded in that shoulders and the head will go forward and you'll start to get that tissue stress and inflammation. Then you may start actually compressing all the muscles that go in that thoracic outlet. You could start the degenerative process, you know. Now the discs are taking a hit. Now the joints are taking the hit here. You're compressing things and it's encroaching on that nerve. These are all things that start with a postural problem initially, and then if there's accidents and degeneration, things on top of that over time, that's what really causes a radiculopathy. Now we know there's acute injuries where things just happen, accidents, car accidents, things where this is, you know, where that happens instantly. And those are different, you know, mechanisms of injury, but the treatment is always the same. Okay, so with physical therapy, now the physical therapist evaluates you in depth. So, you know, you've already seen the medical team, you've already seen the chiropractic team. We kind of know and get an idea based on the x-rays and our comprehensive exam where the problem is, and we relay that to the physical therapist. Now they do their own evaluation. So they're looking at ranges of motion, they're looking at muscles, they're looking at fascia, they're looking at, are things working together? Is this muscle underactive? Is this muscle overactive? Are the deep neck flexors underactive? That's a common one. You know, they're looking at these things so they can design a progressive program to go along with that medical team of reducing that inflammation, to go along with the chiropractor getting those joints moving and taking pressure off that nerve. When you put all that together, not only are you just getting out of pain, and you're getting that numbness to track back towards the neck as we discussed, physical therapy is getting you functionally resilient. So now outside of here, you can work, play, do the things with your kids, do the things with your family, because those muscles are in balance and those muscles are now gonna stop putting pressure on these nerves. They're gonna take over the function of what they're supposed to do rather than have other muscles take over what they're not supposed to do, okay? So there's a balance there, and that's the key to becoming functionally resilient and becoming long-term successfully healthy, is getting the muscles and the posture to do what they want to do. And that, when we integrate everything together, PT is a very, very important part that a lot of times people don't take advantage of, and it's a major mistake, specifically for a cervical radiculopathy. So as you can see, a cervical radiculopathy is very complex, and it's derived by many factors. And it's a condition that really demands a medically integrated approach. Okay, so chiropractic alone can help greatly, but when you add physical therapy to make you functionally resilient, you add a medical team that can give you durable medical equipment to help with that neck problem, to help reduce the inflammation wherever that nerve is, if it's a herniated disc or, just inflammation from, degenerative discs, old school injuries, things that have been there for a while. If you can reduce that inflammation and put all this together, you can get somewhere. And a lot, my number one thing I hear from patients is, doctor, am I going to need surgery? I'm having pain down both arms or one arm or whatever. And everyone's told me that the only thing I can do is get surgery for the neck. And that is definitely not the case. Now, there are instances where things are so progressed and people have tried so many things and they still need surgeries. I'm not going to rule that out. But more times than none, there's a combination for people where you're reducing that inflammation and helping that nerve, okay? Getting those muscles, those deep muscles in there, fixing that posture, getting you out of those patterns that have been there for years, getting motion instead of commotion in the neck, and not compressing those nerves and getting more space in there to take pressure off the nerves. If you can do that routinely and get on a care plan where you're doing that 2 or 3 times a week for a while to get that problem stabilized and get that solved, that is your answer to preventing surgeries. I know tons of people who have had cervical fusions and surgeries on the neck because of various reasons, and it never seems to pan out the way they expected, all right? They may get certain relief over time, but over that time, could be years, they start getting more arthritic changes, more problems, more degeneration, more immobile conditions that cause other parts of the cervical spine to have the same problem they had when they got the cervical fusion or the surgery. So the key is not making it a domino effect. It's taking those dominoes away and actually solving that dysfunction. So here at South Georgia Spine and Joint, we do just that. We use that medically integrated approach to solve all areas of the problem. And when someone does that and they do everything at once, that's the key. People seem to get better a lot quicker. I see a lot of people do, I just did physical therapy for this and nothing else, or I just did chiropractic for this and nothing else, or I was getting some sort of treatments for the neck from the medical team, and I wasn't doing anything else. That's a major mistake, because with cervical radiculopathies, you need that whole approach. You need to get everyone involved to get all aspects of the problem stabilized. That's the key. If you can do that, most people can get out of pain and be surgery free. So at South Georgia Spine and Joint, let us help you. If you've been dealing with this condition and it's going down your arms, you're getting no relief, you can't sleep, it's waking you up in the middle of the night, you're getting weak in your grip and just noticing that it's progressively getting worse, call us, set up an appointment. We'll get you to all 3 departments, and we'll definitely find a solution for you using our medically integrated approach. So for South Georgia Spine and Joint Center, this is Dr. Adam Davis. And just remember, don't just manipulate, integrate.